All right, everyone, it's just about time, so we'll get started. Welcome to the It Takes a Valley virtual town hall. I am Casey Wolfington, Community Behavioral Health Director with Eagle Valley Behavioral Health. Thank you so much for taking time today to join us. For those of you who are joining us for the first time, I'm going to give you a little background about our campaign and these virtual town halls. In December 2019, the Vail Health Foundation announced the It Takes a Valley Transforming Behavioral Health campaign to raise $100 million for EVBH and multiple nonprofits around our community. In June 2020, the foundation hosted the first ever virtual town hall as a way to share the news and information and showcase our partner nonprofits who are already doing such incredible work in our community, focused on behavioral health and raising awareness about the campaign and sharing ways that community members can make a difference and get involved in our programming. Prior town halls were recorded and they are available on the foundation's website, which is the vailhealthfoundation.org, if you're interested in viewing those. Today, we're going to be discussing Eagle County's first and only sexual assault nurse examiner, forensic nurse examiner program. And the timing could not be better because, as many of you may be aware, that April is actually Sexual Assault Awareness Month. So thank you so much for joining us today. Please note that this program was made possible by a generous gift from Mark and Lisa Neparent and the Vail Health Volunteer Corps. They provided funding to purchase the equipment that's needed for these exams, and usually that's a pretty substantial financial barrier, and really has allowed the gifts that we have received from these generous donors to take immediate action. Because of that funding to already have that equipment, we've been able to roll this out rather quickly. So I'd love to introduce our panelist, Jonathan Lovins, Detective Sergeant with Avon Police Department, Amanda Shelley, SANE Coordinator at Colorado Mountain Medical, where we will be housing our SANE program, and Sheri Mintz, Chief Executive Officer with Bright Future Foundation. There will be a question and answer at the end. You can ask questions at any time using the Q&A function. Please use this function rather than the chat function so we have all of the questions in one place. So I'm going to start with Sheri Mintz. Sheri Mintz is our Chief Executive Officer with Bright Future Foundation. And Sheri, I would love if you could briefly talk about Bright Future Foundation and who you guys serve in the community.
I am happy to do that, Casey. Bright Future has actually been serving families affected by domestic violence, sexual abuse, stalking, and human trafficking for over 37 years here in the Vail Valley. And we started, like so many other organizations around the country, in the late 70s and early 80s. It was really a social justice movement against the battering of women. And at that time, abuse in the home particularly was considered to be a private matter, a family matter. There weren't even laws and protections to help victims of violence. But groups like ours started around the country, and we have grown exponentially in those years. Not only has Bright Future grown, but the whole response to violence against women. So now Bright Future has a model that we like to think of as prevention, crisis intervention, and long-term healing. We first and foremost want to prevent violence from happening. And to that end, we have the Buddy Mentors program, which is a big brother, big sister model mentorship program. We also do social emotional violence prevention in the schools. And then our long-term healing is very pertinent to the SANE program. The most important feature of our long-term healing is our therapeutic services, our behavioral health services. And that is led by Dr. Stacy Freudenberg and her growing team of amazing professionals. And also then in the middle of our prevention and long-term healing, we have our crisis intervention. And in that category, we have advocates, we have safe housing, we have actually 3 different housing programs, and we have a full-time attorney on staff who can advise in a number of matters that are very important to victims on their journey to becoming survivors.
Thank you so much, Sheri. Maybe you could share with us a little bit of what a Bright Future Foundation Victim Advocate does.
Absolutely. Well, just as the term would suggest, at the core is to advocate for the victim. And again, we serve victims of domestic violence, sexual assault, stalking. Every case is different, and our services are client-centered. So we're there to provide whatever level of support the victim needs at that particular time. And when we say advocate, some of our staff have that title as their job title, but we are all advocates. I am an advocate. Advocates are trained. There's a minimum of a 40-hour training that is required for our advocates. And in addition to providing support, the other important piece is linking our clients to resources in the community. I often say we can only provide services for one slice of the pie, but it takes a valley. So we are a very important function is to provide resources to all of our other community partners.
Absolutely. Thank you so much, Sheri. And now I'm going to welcome Jonathan Lovins, Detective Sergeant with Avon Police Department. Jonathan, could you briefly share the process that currently Eagle County residents go through when they report a sexual assault?
Yeah, thanks, Casey. Currently, it's a little bit of a challenge without our program. You know, one can always report to a forensic nurse themselves. However, most people don't know how to get in touch with them. So that's where we come in. An incident occurs, whether it's domestic violence or sexual assault, and we need to get some forensic documentation of injuries and evidence collected. That's where we would be contacted. The victim would need to contact law enforcement. And then unless they've done the research themselves, the law enforcement needs to contact the SANE or forensic nursing examiner and arrange for the patient to be transported to either Summit County or Garfield County for the exam. And once that's done, now we still have to get that documentation and evidence collected. So we need to get back to either Summit County or Garfield County and collect that evidence from the exam to put it into our case file.
So it sounds like you've hit on a number of challenges and barriers for both the police department and the victim in this case. Maybe you could spend a little time expanding on the challenges and barriers that you see.
The big one is time delay. Simply traveling is adding, it's a traumatic experience as it is. So the time delay to get to a forensic nurse examiner just adds to the experience in a negative way. The sooner we can get a patient to a forensic nurse, a SANE nurse, the sooner the patient we know can start the healing process. And that's important. The healing process is the most. There is evidence that needs to be collected and documented, yes. And a trained SANE nurse, forensic nurse examiner is an acceptable link in the chain of custody of evidence and documentation, that all that can be used in a criminal investigation. Geographical challenges increase the time without any road hazards. I mean, it's 45 minutes and that's fast to at least an hour to either Garfield or Summit County for a patient to just get there, just traveling time. Add in now snow, landslides, rock slides with the canyon being closed, maybe Vail Pass is closed. that could really hinder and really add to a lot of time to the experience.
Absolutely. Thank you so much. And next I'll welcome Amanda Shelley. Amanda Shelley is the SANE coordinator with this new Colorado Mountain Medical Program. Welcome, Amanda.
Hi, thanks, Casey.
Maybe we could start by having you explain the role of a forensic nurse examiner and a sexual assault nurse examiner. It sounds like we've already heard a little bit, but I would love to hear a little more details about why this is so important.
Yeah, absolutely. So a sexual assault nurse examiner or a SANE nurse and a forensic nurse examiner, which would be called an F&E, both are registered nurses or advanced practice nurses that have had additional education. We did our education through UC Health, and it's a very comprehensive program. It's a minimum of 64 hours that these nurses have taken through UC Health, and it allows us to provide that specialized, comprehensive medical forensic care for these victims and survivors of sexual assault as well as abuse.
Fabulous, thank you. Sergeant Lovins spoke a little bit about some of the challenges that victims face when there's delays or there's not an exam immediately available. Could you expand a little more on some of the challenges that you see from the patient side?
Yeah, absolutely. So again, our goal is to start this healing process for these victims right away. And there's definitely a delay in that when they are either having to drive to Summit County or Garfield County for their care. And I think a lot of the times we may miss people during this because they may feel like, I don't want to drive over Vail Pass. I don't want to go to Glenwood Springs. And so I think that we could be missing victims that could use our services as well as Bright Future Foundation services. And so I think that delay in care is a critical piece as to why it's important that Eagle County is offering this program. Our biggest goal is to provide that medical care as well as getting them information out in the community, such as Bright Future Foundation and different services that are available to them. And so I think those delays, we're missing people for one, and two, they may not be able to make it over Vail Pass sometimes. And so I do think that it's important that we have this program in Eagle County and to be able to offer a timely response to these victims.
Absolutely. And I actually love that you guys have all brought up this idea that this is a program that starts that recovery process. You know, in order to maximize evidence collection, oftentimes victims can't do certain things like shower. And so having extended delays, and sometimes it sounds like with weather, those delays could be upwards of possibly a day, if not several hours. It could create a really re-traumatizing experience for victims in a way.
Absolutely.
That's great. Well, let's go ahead and jump a little bit into maybe just even the reporting process, Amanda. I know that there's different types of reporting, and we heard a little bit from Avon PD that sometimes it comes through law enforcement, but sometimes there's other options. Could you explain those options?
Yeah, absolutely. So the way our program is going to work is we will have a nurse available 24/7, 365 days a year. We have a hotline that they'll be able to call, and I can give you guys the number to that as well too. We have a hotline that victims will be able to call to reach a SANE F&E directly. From there, we can help guide them in the different reporting options that they have, one which would include law enforcement. So that would be a full case where law enforcement would be involved, and different systems throughout the community would get involved in that as well too. But they also have two other options that they can choose that still includes evidence collection if they choose to have that done. One of them is a medical reporting option. Law enforcement, we do get a case number from law enforcement, but with the medical option, the victims don't necessarily at that point in time have to I'm trying to think of a good word for this, but they don't necessarily have to interact at that point with law enforcement if they choose not to, but they can still have all that care provided. They can still have the medical care, they can still have the forensic evidence collected, and they can choose to still have that evidence analyzed as well. So just like with a law enforcement case, that evidence would go to the police department, but with the medical reporting option, the victim still has the choice on whether at that point they're going to, what type of communication they're going to have with law enforcement. And then there's the anonymous reporting that they can choose as well too. And with anonymous, we can still collect evidence and we would still provide that same care. We would still get them in contact with advocates center, such as Bright Future Foundation. We would still provide that medical care and still could collect that evidence. However, their name would not be attached to anything on that chart. And so it would be truly anonymous. And then we would hold that evidence, or the police department would hold that evidence for a period of up to 2 years, which again gives that victim time to choose if they want to proceed with different cases such as law enforcement at that time. It just gives a victim more options instead of just feeling like they only have one path that they can go down. And so allowing us to speak with them and give them those different options, it also allows them to start that healing process and get some of that control back after being assaulted.
That's fabulous. It sounds very similar to what Sheri mentioned earlier, is how can we make sure that individuals can get the care they need and also empower them to be in charge of a lot of those decisions.
Mm-hmm.
Yes.
And I think it's also important to remember right now that when we talk about a victim, they have just undergone an unbelievable trauma. So as we are sitting here very calmly talking about options, talking about next steps, I mean, it's incredibly overwhelming for this victim, which is why it is so important that we do have this local program and that we're able to make this process even a tiny bit easier for the victim.
Absolutely. Thank you so much for bringing that up, Sheri. Completely agree. Amanda, I'm going to go back to you for one more second and have you talk a little bit about program specifics. Let's talk about launch date and the number of nurses, and maybe just describe a little bit about our core program here.
Yeah, absolutely. So we are really excited because we'll be able to offer this again, 24 hours a day, 7 days a week, holidays, it doesn't matter, weekends, we will have somebody that's available. We will be launching this on May 1st. So that's when our first on-call will start. We have a 45-minute response time to the Avon urgent care. We do call, we have the phone available and we do answer that right away, but to get to where our victim is, we do have a 45-minute response time. And then we currently right now have 14 nurses that have been trained in this program through UC Health, and they're all very excited about this program and what we can offer to victims in the community. So what they'll do is they will call our SANE hotline, which is 970-422-3202, and that will ring directly to the SANE nurse that is on call. And from there, the SANE nurse and the survivor will be able to talk about different options, how to get Bright Future Foundation involved as well, and then we can collaborate to getting that patient's care, the comprehensive care that they need at that time.
Absolutely. That's fabulous. And I think it's important to note, what is the number of nurses that you mentioned again?
Yeah, so we have 14 on our team.
Okay. And I'd love to tell the audience that this is, I think, at least at the time of this recording, is probably the largest community-based SANE program with regard to staffing. A lot of programs are centrally located and based out of a hospital, but having 14 nurses, I think, is just so exciting, and I think shows the commitment of our medical community of knowing this necessity. Like I mentioned earlier, of having the volunteer corps already recognizing this important piece. So it's exciting to have that level of commitment across our medical community. Sheri, maybe you could spend a few minutes talking about how this collaborative program, the SANE program, which I know you and I have been talking about for over a decade of having the need for this program in our community. How do you see this helping victims?
Oh, enormously. As we said before, I mean, the biggest barrier was traveling. And again, this is such an overwhelming process. So when a victimization has occurred, then the concept of having to drive out of county to receive services and services that likely the victim has never heard about before, had no understanding that there is such a thing as a SANE exam and the importance of having this happen. So I think that that's been one of the biggest barriers for years, is explaining how important it is to make the decision to move forward with a SANE exam in a timely manner so that there are options in the future. But what our statistics right now, we serve about 85% of our survivors are domestic violence, and about 15% in the sexual assault realm. We expect that number to shift quite dramatically, because what has happened is when victims need to go out of county to receive the SANE exam, then they don't have the same coordination of services for aftercare. And what our program, the way it's been conceptualized, because a Bright Future Advocate will be there with the victim as they are going through this process, hopefully creating a bond and rapport so that then they can seek the aftercare that they need. All of Bright Future's behavioral health services are 100% free, no cost to our client, and can occur for whatever length of time the victim needs. So we are not limited as to a certain number of sessions. And oftentimes our victims that we work with, they've had multiple victimizations over time. So they may actually come in for treatment around a particular issue, but then it brings up other issues that have perhaps gone unattended for many, many years. So again, it is just incredibly exciting to be able to offer this right here in Eagle County. There's actually a statistic that only about 17 to 20% of rural hospitals actually have a SANE program. And in rural areas, and you know, we don't necessarily think of our community as a rural area, but we are. And in rural areas, often victims do have to travel. Sometimes in some rural areas, they may even have to take a flight to get to the proper care that they need for a SANE. So this is just a remarkable step for our community.
So it sounds like it's going to have an incredible impact on our victims and individuals who have been traumatized. It sounds like both for domestic violence and sex assault. But Jonathan, it also sounds like it's going to have a pretty large impact on law enforcement in your investigations and how you guys approach cases. Maybe you could spend a little bit of time talking about the impact on law enforcement.
Yeah. So primarily it's going to allow us to connect the resources to the victim in a much more efficient manner to begin this healing. We know evidence is important for accountability, but no one ever knows how a court proceeding is going to go. So the most important thing is to make sure we take care of the victim and get them the resources that they need, that are necessary for the best opportunity to recover and live a happy and healthy life from here forward. It will allow for more timely transfer of evidence and documentation to law enforcement. It could encourage victims to report knowing that we have the resources right here in our area, and it'll allow for law enforcement and the forensic nurses and the Bright Future Foundation to have a tighter working relationship to provide at a high level for our victims.
Thank you so much. And, I think that's so important. Ultimately, safety and support of victims is always the number one priority, but it sounds like there's going to be this fallout of the more cases that we can collect evidence for, perhaps the more cases that can get pushed to trial. And even if, those continue to be challenging cases, the more we're going to be aware of these things happening. And, I think when we're aware of things happening in our community, it creates a safer community. So I love that you guys brought those pieces up. Let's talk a little bit, before we go to question and answer, let's talk about this collaboration. How is Avon Police Department collaborating with Vail Health and Colorado Mountain Medical and Bright Future through the SANE program?
So Avon PD has always supported the SANE program efforts all along. It's through working and training with our partners, being your organizations. Our staff is well educated, and we are always conscious of victimology. And we know that one doesn't want to spend their time talking to a uniformed officer. We need to get them into the care of the professionals for the best results. And that's how our partnership will be so strong and powerful for the victims, is you'll do, well, the forensic nurses will do a lot of the work. We'll get a lot of the information and documentation, evidence collection, all through them. They don't have to look at one of us. And hopefully that'll be a more pleasant experience to begin this healing.
Absolutely. That's amazing. Well, thank you so much for all sharing these other aspects of the program. I would love to dive into the questions and answers. And just a reminder for any of you viewing, please do put your questions in the Q&A box, and those can be sent over to me. And I'll read a few that we have already received. So we hear in the news about rape kits being backlogged or not reviewed. And I feel like this has been in the news more prominently recently. Maybe, Jonathan, could you spend a little bit of time talking about what happens after you collect that evidence, after you pick it up from the SANE program? Where does it go? What's the time frame? And it sounds like also the accountability.
Yeah, so we have refrigeration in our evidence vault. And those kits are kept, and depending on how it was reported, if they want to be anonymous or they don't want to, they're still deciding on how they want to proceed. It'll sit in our evidence until the right time, and then with the cooperation of the victim, we'll send it off to our partners at CDI, where they'll do the forensic analysis and to search for DNA profiles or whatever we're looking for due to the circumstances. And then moving forward, we would pull in our partners, the experts, the forensic nurses for the testifying in court and following through with the process.
And from what Amanda spoke about with the different reporting options, it sounds like the minimum amount of time that evidence would be held if we were waiting for an individual to decide whether or not they wanted to engage law enforcement would be 2 years. Is that accurate, Amanda?
So the maximum amount of time would be
yes,
2 years that they could choose. Yeah. Now, if they chose right away to do law enforcement and medical reporting with evidence analysis, that would be sent off right away to CDI. Now, again, with the medical reporting, they can still choose to hold off on sending that evidence collection, and same with anonymous reporting. But they have up to that 2 years that it would be held at the police agency that responded for the victim to decide if they wanted to pursue in a different manner.
Is there any cases when it wouldn't be held for those 2 years, that it would be disposed of earlier?
I'm not sure on that, Jonathan. Would there be a time that you guys wouldn't hold it for that 2 years?
Not that I can think of. We have retention schedules for certain classifications of crimes and investigations, and this is one that would be held on to for quite some time. Great. So disposing of it before that, I can't see any reason why we would do that.
Thanks so much. Another audience question, what is the plan to keep this program funded? And really, I think maybe also let's provide an overview of what it takes to run a program like this. It sounds like there's a lot of collaboration and a lot of support. Sheri, maybe I'll actually go to you first.
Okay, sure. Well, speaking of Bright Future, our funding is very diverse. So we have advocates and we have behavioral health staff that we are now deploying to this project. So our participation is not really dependent on any particular funding. We actually are hoping that in the coming years, we can apply for some very robust funding sources. There are grants available through the Violence Against Women Act. And once we get this program up and running, it's my hope that we could, as a community, qualify for a rural grant that would provide, significant funding for the program and for expansion of the program. But again, I think just like with Bright Futures funding, it will be a combination of generous donations from donors who care deeply about this type of work, in combination with government funding that we might be able to layer onto that.
Absolutely. And I'll take off my host hat for a second and just add to that is, I think that diversity of funding is so important, because I think oftentimes, even when we are incredibly successful of having grant funds, that it covers such a minimal part of the program that it makes it very difficult for it to be truly victim-centered. And so it's a more bare bones part of the program. And so to have this incredible collaboration really takes a lot of the generous donations and dedication of our community and recognizing the impact. So thank you guys all who have donated, who are interested in funding this program. Sheri, I'm actually going to go back to you again for a question. This one's regarding behavioral health support. Could you talk a little bit about how we are prioritizing behavioral health support for individuals who have been through a trauma throughout this program?
Of course. Well, earlier I mentioned Dr. Stacy Freudenberg. Stacy is our clinical director, and she was actually an intern with us under your tutelage, Dr. Wolfington, a number of years ago. And at Bright Future, we have what we call a tiered training program. So we have Stacy, who is a licensed psychologist. Additionally, we have hired a postdoctoral fellow who will be with us for a year starting in August. And Bright Future, in combination with EVBH and another partner in Denver, we have the COPIC Consortium, which is the Colorado Psychological Internship Consortium. So we are constantly training professionals from all over the country, and we've been prioritizing particularly bilingual English-Spanish doctoral interns, with the hope that once they are trained, they will remain in our community. And it's so important that EVBH has been a leader in destigmatizing behavioral health services. And when we talked about barriers for victims of sexual assault, there's a huge stigma attached to that. And really all of our efforts working together to destigmatize and to provide the local services will make access for long-term treatment so much more accessible to our local victims.
That's fabulous. Thank you so much. A lot of these audience questions seem to be kind of focused on Bright Future. So Sheri, you're not off the hook yet. It's so incredible that we have resources to engage someone who has been the victim of a trauma. But how do we as a community, and maybe this is kind of a two-part question, of what services are already in place or what programs already exist to go upstream and to be looking at behaviors that maybe could prevent sexual assault, and what programs maybe still need to be in place that we as a community need to develop?
Absolutely. I think it really does start at a very young age. And like I mentioned earlier, we have prevention programs, Bright Future, in the school that are specific to sexual assault prevention. And right now we're focusing on an activity on a program called Hotspot Mapping. And we're working with middle schoolers and a bit in the elementary school, and now putting a little bit of an emphasis into the high school. And what hotspot mapping does is it really focuses on an individual middle schooler's perception of safety and where they feel safe and where they feel unsafe. And I'll bring up a phrase that we learned at a conference many years ago. Jonathan, Casey, myself, and many other community members were at a conference, and the theme was start by believing. So I think as a community, it is so important that we start by believing. Sometimes if a friend, a family member shares a story of victimization, it's difficult to hear, it's difficult to accept. But if we start by believing, then that can begin the healing process.
Right, absolutely. And it changes how you engage with someone and the different ways that you can support them. I absolutely love that. And, you know, I'll go over to Avon PD for a second, because I think there's another piece of this. Avon PD has been a huge collaborative partner in some more workforce-based prevention programs, because I think part of the piece is that there's prevention that needs to start at an early age, but then we also need to look at some of the locations that we see sexual assaults stemming from. And, you know, I don't want to make a causal piece here, but Jonathan, maybe you could talk a little bit about what you see with substance use in our community, and maybe ways that you guys and Bright Future have partnered with some of our realtors, you know, our retailers, I should say, or our restaurant owners.
Yeah, so unfortunately, many of the incidents, not solely, but a handful of them will be alcohol-induced, you know, bad decisions. And so we try to reach out with our partners, the business partners that get seasonal employees, and just try to work it into their orientation to provide their new employees with a little spiel on responsibility and enjoying themselves, but safely doing so, so we don't have these unpleasant experiences.
Yeah, absolutely. And making sure everyone's aware of the resources. So that way, if they know a colleague or a friend, you know, they're pretty substantial employers in our community. So also knowing this is a great resource to get people connected with various services. So thanks so much to bring that up. Sure.
Also a program that we were in the process of launching pre-COVID called Safe Bars, where we were working with additional community partners to work with restaurants, work with bars, to educate the staff pretty much on an upstander perspective. You know, how can you safely intervene if you see a situation that doesn't look good, if you see that there is the potential that someone could be victimized, how can you possibly intervene in a safe way? There's the Safe Taxis program to be able to, you know, get people home safely. And again, as Jonathan said, you know, there are so many different types of crimes that involve sexual assault, but many crimes are exacerbated by the use of alcohol particularly. So if we can work with that community, and now that we're hoping going toward a post post-COVID society resume our work with the Safe Bars program. I think that would be very helpful.
And I actually love that you bring that up, because that really shines a light on this being, how do we have preventive measures that are sexual assault or escalating violence in general? This could be an argument among possibly somebody who's dating or in a relationship. And how can we make sure that people know of the resources that are available, whether or not they're even a community member? That could be happening, they're on vacation. I know at Bright Future, we used to have a number of hotline calls that were individuals that were just visiting too. How do we make sure we're connecting them? How about thoughts of expanding this to be a gold standard for other rural communities? Sheri, you mentioned that there are certain rural communities that do not have the ability. How do you think this program could really be something that could be replicated across rural communities?
For sure. Just in the same way that many of our programs, particularly COPIC, we are trying to expand our reach into other rural communities. And I would like to see as sort of a natural extension of our behavioral health services that there is always a SANE program. And I actually was not a part of all of the research and the background that went into planning this program, but it was massive and extensive. So if we were able to share our templates, if you will, this is how it's actually working on the ground, and kind of take away maybe some of the fear and anxiety that other rural communities may have, then I definitely think this could be a model for other rural communities, because we are making it happen. We've started with nothing, and there's going to be a strong and robust program as of May 1st. It can happen.
Well, and I feel like something that's really important to acknowledge is looking at the panelists here that, thank you guys so much for joining us. But part of the piece the reason we're successful is because often you start with one partner, and that this program was really able to be developed with the input of every partner. We were able to say, what does law enforcement need? What's going to make sense from a victim-based, trauma-based perspective? What do the nurses need to stay engaged? And how can we successfully recruit them to be the largest community-based program in Colorado, so that we don't have to worry about having 2 nurses that then we have to expect to be on call and just trading back and forth. So I think that's huge, and it's a testament to all of you. So thank you guys so much. All right. Well, I am going to thank all of you and all of our attendees for joining today's discussion. EVBH is a model that we want to have replicated across the community, both for behavioral health, and we're thinking about behavioral health. You cannot have strong behavioral health without safety in our community. So programs such as the SANE program are vital for success of overall behavioral health in our community. We would love if you could take a minute and visit the ittakesavalley.org to learn more about the fundraising campaign, to make a donation or sign up for the foundation's newsletter. And the next virtual town hall will take place this summer, and you can receive more information about that soon. And again, thank everyone for joining us. The hotline for SANE, again, is 970-422 it just went away. 422-3202. And really, one other thing I will mention is how this program was developed is we really try to have a no wrong door. Bright Future Foundation has a hotline. The SANE program has a hotline, but everyone is incredibly interconnected. So any place that someone reaches out, they will be able to access all the services available through this program. So thank you all for making our community a safer place. And we look forward to seeing you this summer during this series. Thanks, everyone.
Thank you.